It's my great pleasure and honor to welcome Dr. Adeera Levin as a speaker to the RRI conference. Dr. Levin, she is a professor of medicine and head of the Department of Nephrology at the University of British Columbia in Vancouver, Canada. Now, Adeera, you will talk about global challenges of epidemiology and care for end-stage kidney disease patients. Could you tell us a little bit about what you will talk about in your presentation?
So without giving it all away so people don't have to come to my talk, what I'd like to do is raise awareness of the community around the challenges of both delivery of care as well as research in the area, because if we have better research, we have better care delivery mechanisms and better preventative mechanisms. And so what I'm going to try and do is paint the picture of where we are and where we're going as a nephrology community in the context of care and research.
Yeah, so Adeera, what do you think are the most important barriers to access to kidney replacement therapy globally?
I mean, I think, without trying to be trite, it's money, right? The fact is that it costs money for governments or individuals to access care, whether that's end-stage care or preventative care. And so I think that's one of it. The lack of public awareness about the importance of early identification and prevention, and that governments, interestingly, seem to want to invest ultimately in dialysis, but not in the prevention of, and therefore it makes it less accessible. It's a long-winded answer, but I think advocacy and lack of public policy and dollars to support the continuum are the big things globally.
Yeah, now, Adeera, I'm wondering, do you think that the nephrological community has, over the years, failed to adequately address the question of this global shortfall?
I mean, yes, I think the nephrology community has been divided. There's been, there are the haves and the have-nots. There's low and high income countries. There are various different incentives for things. And I think that as a global community, we are beginning to look at innovative ways to access kidney care totally across different spectrums. And I think that's very important. We failed over the years, yes, because we've been learning as we go. And so I don't want to beat us up too much, but we're learning.
Sure, no, understood. I mean, I'm wondering, do you think, Adeera, that this quest for prevention, for kidney replacement therapy has been too much focused on highly developed countries, on high-income countries, and in a way neglected the situation on the ground in low or lower middle-income countries?
So I guess there's two sides to that, Peter. So I don't think we failed to address the importance of early identification and therefore implementing simple measures to delay progression. And then in the high-income countries, we got focused on innovations, which are great, but without necessarily addressing, again, disparities in healthcare. So I think it's a combination of things that we probably need to focus on a little bit more.
Yeah, I think we can agree that climate change is happening, and there is now a growing movement to implement so-called green dialysis. I am wondering, really, how do you think will this play out on a global stage? Is actually widening the access to kidney replacement therapy and green dialysis, are these competing goals?
Not necessarily. I think green dialysis can be done a lot of interesting ways in Australia. As I know you're well aware, there are a lot of groups that are doing recycled water and solar panels and sort of reducing the footprint, if you will, of dialysis units. I think that's a first step. I think we need real innovation. I think others have said this much more eloquently than me, but we've gone from LVADs that allowed you to stay in the hospital and never leave to a wearable LVAD, right? We have not done that same innovation in dialysis care. So the green will come from lack of facilities, lack of big uses of electricity, large amounts of water, being more clever, maintaining residual kidney function. There are all sorts of ways that one can think about green, which is less of things, right?
Yeah,
But I mean, high income and low income, I would think that there's incentive in lower resourced areas to also be green, because that will ultimately cost less. But as you well know, governments in those places are far more dealing with maternal fetal health and poverty and malnutrition than they are with the percentage of the population that have kidney disease. So getting people's attention isn't always so easy.
Yeah, I mean, one of the consequences of climate change is, as we know, water shortage, and hemodialysis in particular is so water intensive. Do you think that that water shortage will impact access to kidney replacement therapy in certain regions of the world?
It's a great question, and frankly, I'm not sure that I've quite thought about it that way. So thanks for asking me to. Undoubtedly, yes, but wouldn't that help us to innovate? And why do we need so much water? And are there other ways to think about both hemodialysis techniques as well as peritoneal dialysis? And what are ways to use less water, or recycled water, or rainwater, or whatever? So I think that it will challenge us, no doubt.
Yeah. Okay, so really thank you, Adeera. It was a great pleasure chatting with you, and we all are looking forward to your talk at the RRI conference. Thank you for joining us, and I'm really looking forward to it.
Oh, thanks very much, Peter. Thanks for your questions. They're thought-provoking for me as well.
Thank you.